My name is Jolene Neto, and for this video, I'm going to be demonstrating a cap change on the central venous line. So for the cap change, you're going to need a flush and you're going to need new caps. Usually the cap, there's 3 of them, but for this demonstration, I only have 1. So you're going to want to make sure that you remove the patient's pillow, that you lay the patient down flat. That way when you open any of this part or take the cap off, no air is going into the patient or the patient doesn't bleed out. So we're going to verify the patient's name, date of birth. We're going to assess the patient for any pain or discomfort. We're going to explain the procedure to the patient. We're going to let the patient know that we're going to be changing the caps and that there may be a little bit of discomfort while they're laying down and that we're going to have to remove the pillow because we don't want any air to go into the patient or any for the patient to bleed out. So you're going to want to let the patient know. During the changing of the caps, you're going to want the patient to look away from the site that the cap's on because you don't want them breathing over that area to contaminate the caps when you're changing them out. So you're going to have your new caps and you're going to have a flush. You're going to want to cleanse your hands and you're going to want to put gloves on. And you're going to want to open the packaging for the cap, not to touch the area. You're going to want to take the flush cap off. You're going to want to prime I opened it backwards, sorry. You're going to want to prime the cap so that way that there's normal saline in the cap. You're going to have that ready. You're going to let the patient know to look away. You want to change the caps really fast. So you're going to get the clamp. You're going to make sure that your line is clamped. That way the patient does not bleed out. You're going to remove the cap from the packaging. You're going to unscrew this cap and you're going to want to place the new cap on. If you are going to administer medication, you want to administer 10 cc's of normal saline or the sodium chloride flush in a push-pause method. And then after you administer the 10 cc's push-pause, you're going to want to reclamp the site. You're going to want to remove the syringe. You're going to want to cleanse the cap again. Place the medication. You're going to administer the medication slowly, half, then pause for a minute, half, then pause again for a minute, and you're going to administer the rest and pause again. Then you're going to remove that. You're going to cleanse it. You're going to wait a minute. You're going to replace a new flush to the site. You're going to want to unclamp it and administer the rest of the 10 cc's of the flush to clear the line. Once you're doing that, the last bit of the 10 cc's, you're going to want to start clamping the clamp bag and push the flush, the remainder of it, to create the pressure in the flush. You want to make sure that your caps are on tight and that it's clamped at all times. And that's a demonstration of cap change and IV push medication.